Hello, my name is Madeline Fireman. This is my personal philosophy project, and the three areas that I decided to talk about are scope of practice, therapeutic play, and preparation and education. Before I began my master's program, I knew that the scope of child life practice was that child life was a field where the work is creative and changes nearly every day. I knew that child life specialists educate patients and families and advocate for procedural accommodations like comfort holds. I knew that they engage children in medical play. And when people would ask me what this career was that I was pursuing, I would usually tell them it was somewhere between social work and play therapy, and that the goal of a child life specialist is to make the hospital experience as non-traumatic as possible. I now know that what makes the scope of practice of child life unique is the focus on the child's psychosocial wellness. Play therapists and doctors and psychologists all focus on diagnosis and treatment and problem solving, while child life specialists look at all of those elements and work to determine the high stress or developmentally detrimental aspects of diagnosis and treatment based on their individual assessment of the child. They can then help children and families develop coping techniques that they can use to empower themselves to respond better to procedures. I wouldn't say that my thinking has shifted, but my knowledge of the scope of child life practice has definitely expanded. This class and my other classes this first semester of my child life master's have provided me with concrete knowledge and terminology to my previously non-academic understanding of children's development and the needs of hospitalized children. I've always loved working with children, and I have for my whole life, either professionally or casually babysitting and having younger cousins and a younger sister. And so I really feel that I understand children, but having terminology that validates my response to children's emotions has been really gratifying. My understanding of the scope of care, like I said, has definitely expanded. I now understand the scope of child life practice within the multidisciplinary team, so the role that they play within the team and the ways in which child life specialists interact with and partner with members of a patient's team to provide the best therapies for the child. I've learned so much about the responsibility that child life specialists have to the patient's entire family, and I've learned that the scope of practice expands beyond patient care to family care and a child's life after hospital, and helping children adjust to life outside the hospital, and communicating with schools and camps, and helping communities reintegrate children back into their normal life in the outside world. I've also learned that patient outcomes and patients' mental health are greatly improved when child life specialists educate and prepare families for the hospital experience. And there was I found a great article by Catherine McHugh, a child life specialist and an expert in the field. And she says, what makes child life unique is the philosophical focus within which most of our practice occurs. Child life is primarily preventive, proactive, and health enhancing. On a day-to-day basis, much of what we do is assess possible high-stress or development-threatening situations and provide children and families with tools to manage and cope with the challenges inherent in these difficult experiences. Of course, child life professionals have the ability to intervene when problems develop, such as helping a child who will not take his or her medication find a successful and non-traumatic method for the required medicine. But most of our work is about psychosocial health and resilience and the maintenance of normal developmental skills across all categories. It is always easier to prove successful problem solving than it is to illustrate successful prevention, but that's what we do. My next topic was therapeutic play. I came into class knowing very little about therapeutic play. I knew that play was important to children, and I knew that child life specialists advocate for play in hospitals, but I did not know that play itself is inherently therapeutic or how therapeutic play was implemented. I now know that to help children succeed in a hospital setting, we must first understand the importance of play to children. Play is cathartic. Play is the medium through which children cope with life's demands and interpret the world around them. So to help children, we must speak to them in their language, play. Therapeutic play is facilitated by child life specialists to help children cope with feelings that they cannot handle with rational thought, that they may have not developed yet. I've learned that play is an arena in a healthcare setting in which children can exert power and make choices. And play helps children feel a locus of control, and that can help with behavioral issues that may be occurring. Play is the vehicle through which children can best internalize new information. So in order to educate a child on a diagnosis or procedure and expect them to understand it, the child life specialist must present the information through the lens of play, the language of children. Child life specialists help the child connect play to the experience in a way that will offer the child control and give them mastery over a situation, which inspires confidence. And it's a chance for children to succeed and to grow stronger from their hospital experiences instead of suffering from a traumatic procedure that they felt unprepared for. Therapeutic play also allows children to debrief after procedures in the hospital. So if a child is having behavioral issues after a procedure or after some sort of treatment, and they don't want to, they won't open up verbally, or they're not at a developmental stage where they can express their feelings, child life specialists can involve the child in therapeutic play or offer options for play in a hospital playroom that will allow the child to open up about their feelings. They can draw pictures, or the child life specialist can ask open-ended questions while they participate in free play. And many times just having the opportunity to express themselves creatively through play or through art or through music lets the child relax a little bit, because they're in their element, they're speaking their language, and thus they can express what they've been feeling and overcome or better understand those feelings. The last topic that I looked at was preparation and education. I came to class not knowing much about this topic either. My only experience with preparation and education was shadowing a certified child life specialist in an emergency department and in a center that provides pediatric and forensic medical evaluations. In the emergency department, the child life specialist provided preparation for an older teen by just explaining the procedure that he was going to need to undergo. It happened to be stitches, and so she was just explaining to him what it would feel like, what he would smell. He asked if it was going to hurt, and she was honest, and I think she said something like, "It hurts for some people, but we give you some medicine that will help it to not hurt as much." And in the center that provides pediatric forensic medical evaluations, this is obviously a very highly sensitive facility where I didn't know the details of the children's situations, but most of the children had experienced sexual assault, and so the role of the center was for a doctor to examine the child for signs of sexual assault, and then to interview the child in a private recorded setting that would then be used by the police for further investigation. So I sat in the waiting room with the child life specialist, and she had a little medical play, a little anatomical doll, and she gave it to the child to touch and hug and explain to her what the doctor would be looking at, so that there weren't any surprises when she went to see the doctor. I now know that preparation is child life specialists through preparation can help children gain control over a situation. The more information that children have, the less there is a fear of the unknown. Knowledge really is power. Child life specialists tailor preparation based on family dynamics and family variables, and they create individualized education and preparation plans that will best equip families for procedures. Preparation is everything from introducing children to the sensory experiences involved in a procedure in order to desensitize them, so showing them the equipment that will be used and the examination or procedural room, letting them touch things, letting them smell things. And preparation is also helping children and families identify resources within the family that they can call upon, and helping families rehearse coping methods that will emotionally and psychologically prepare them for procedures and for what comes after procedures. My understanding of preparation and education has certainly grown. I have an appreciation for the developmental considerations that child life specialists must take into account when creating a plan for preparation. I've really learned so much about child development and very, very specific facts about what types of preparation work best for which age groups, and then also how to assess children and create an individualized plan, because age is not always the factor, and development is not always the factor. So I've really learned a lot about that through the class as well. I learned that the 3 elements of preparation are imparting information to a child, encouraging emotional expression, and establishing trusting relationships with the hospital staff. And I really appreciated these, and I think these can be expanded upon in so many different ways. And that these 3 elements of preparation call upon every other scope, call upon the whole scope of practice that child life specialists utilize. Imparting information to the child is done through play and therapeutic play. Encouraging emotional expression can also be done through therapeutic play and preparation, and giving children permission to express their feelings is something that I hadn't thought about. Children often are told to be seen and not heard, or their emotions are dismissed by parents who don't understand that every emotional response that children have is a response to something. They're not just upset for no reason. There's a reason, and when their feelings and their emotions are validated, they're more likely to express those and to let adults know what they need. And then establishing trusting relationships with hospital staff is something that I'm really excited to do as a child life specialist. I want children to feel comfortable around their doctors and comfortable enough to ask questions, because you don't know, and you don't know things until you ask. And there's definitely a paternalistic assumption, especially with children and their relationship with doctors. And the better the relationships are, the more emotionally prepared children will be for procedures and treatments. In one of the readings, a quote really stuck with me by Paulo Freire, who wrote Pedagogy of the Oppressed. The quote said, "Our liberation is directly related to our ability to be liberators, i.e. to help others, including children, create the power that makes them our peers as often as possible." And I believe that this means, in the context of preparation and education, in the context of child life specialists being advocates for children, I believe that this means we empower children by educating them, and imparting knowledge to children through their language of play is how we respect their feelings and concerns and give them the tools and the power to help themselves.